Last talk before lunch is Armen Henderson. You hear Armen? Oh, okay, he's coming. He's going to be talking about a medical model of community-centered disaster relief in South Florida. He's from the Medical School, and he's making his way down the stairs.
No. Okay. Hello.
There we go.
All right. I understand I stand between you and lunch. Okay. So my name is Armen Henderson. I am a physician at University of Miami in the Department of Internal Medicine. And today I'm going to be talking to you about how we as a community in South Florida, particularly among the poor and black communities, have tended to respond to hurricanes after Hurricane Irma in 2017. So, yeah, you guys know this already. What is climate change? But it's also, food insecurity, violent crimes, air pollution, which vector-borne illnesses, and also mental health-related disorders as well. I'd like to open with talking about the social determinants of health, basically where you live, where you work, your education background, et cetera. These are the things that really affect people's health when you live at a certain income level. So with climate change, basically, climate change makes all these things worse. And there are studies on that. And so, for instance, climate change and mental health, people get flare-ups of their chronic disorders, or they get new PTSD, et cetera, and depression, depending on, the severity of the climate disaster. Climate change affects food, et cetera. There's a rise in murder also when it's hotter outside, and it's been more hotter summers than what we've seen. And this is data around that. And also climate change and health. Basically, if you have a chronic disorder and you are a part of some sort of climate emergency, now you have to evacuate, then it can basically make your chronic disorder that much more worse. If it's heart disease, if you can't get access to your medications, et cetera. And basically, there are 250,000 additional deaths per year due to malaria, malnutrition, and diarrhea, and heat stress. And these are people who may not even have chronic disorders either. And this is no matter where you live as well. Due to climate change, pollen counts go up, et cetera, and it makes asthma worse. And due to the increased CO2 in the atmosphere, and people get allergies more often. They get it later on in life, et cetera. And so there are more vector-borne diseases, which and there's one mosquito that's basically responsible for a lot of vector-borne diseases, which a lot of those are also home to South Florida as well. Puerto Rico as a case study with climate change is just, it's ridiculous, especially with what we've seen recently with FEMA, et cetera. So with that said, I want to skip to what we saw during Hurricane Irma. Basically, in the United States, you would say that, we have things in place to help people regardless of socioeconomic status or race. But basically what we saw was that there was a disparate response to hurricane emergencies, to the resource allocation during emergencies. And because of that, basically people were without food and water, even though reports on the news said that we had food and water. And so after that, the lady on your left, her name is Valencia Gunder. She basically went around with a grill and she fed like 30,000 people within Opelika, Miami Gardens, Liberty City, and Overtown, which happen to be the urban, the black, the poor neighborhoods of Miami-Dade County. And so basically after that, I was with her during that time, and I was checking on elderly people and making sure people had access to medications, or if they needed to go to the hospital, we would find some sort of transport for them to the hospitals, or we had some sort of medical need that we could do on the spot. We did that as well. And after that, we basically started this community-led effort called the Dade County Street Response Disaster Relief Team. And since 2017, we've been meeting communities' needs before, during, and after a hurricane. Basically, what we do is we educate physicians, we educate medical students and residents and other medical professionals about the risk associated with hurricane emergencies, particularly in emergencies, but also climate change as well. We also educate community members on what they need health-wise in terms of emergency. And we direct them to community-run shelters throughout Miami-Dade County and all the way up as far as Broward as well, that they can go to if they can't afford to leave or evacuate their native neighborhood, all which happen to be in places like schools or athletic clubs, et cetera, recreation centers, walking distance from their home, basically. Basically, you'd be surprised to know that the majority of deaths happen from, the flare-up of chronic diseases, but also from people who get carbon monoxide poisoning from using, if they don't have electricity, they're more likely to use things like, gas stoves or also fire pits or charcoal grills. So a lot of the deaths happens from those two things. Basically, the reason why our model was so popular and why we got funding for what we do is because there was a campaign by an organization called Radical Partners. And how am I doing on time? You have time. Okay. Radical Partners, who basically surveyed the neighborhood, and they got 10,000 respondents, and people wanted to know, the ideas that they came up with range from food insecurity all the way up to climate change. And one of the ideas that they had is that they wish they had community-run shelters that were in walking distance of people that work there or that volunteer there that they actually trusted as well. And so this idea was actually born out of people who wanted it in the community as well. It was started by myself and another medical student, I'm a physician, she's a medical student at FIU. One of the reasons why I think that this model is so good is because it's not located in a silo. I work for University of Miami, but there are medical residents and medical students and medical professionals throughout 5 or 6 different medical institutions throughout Miami-Dade County, and also hundreds of community organizations as well. This is just one of the handouts that we use to talk to some of the people in the community. At community centers, we hold workshops and tell them what is climate change, how does it affect you, how does it affect you and your health, and basically, hurricane healthy tips. We talk to people in churches. We go to libraries and workshops all throughout Miami-Dade County before hurricane, and actually we ramp it up a couple of months before hurricane season as well. But all year round, we do these things as well. We have them in different languages because, Miami is so diverse in Spanish and Creole as well. This is a map of some of the community shelters that we've run. There are 2 emergency response centers. There's one in Broward. There's also one in Liberty City. And they're called the Community Emergency Response Center. But we also have a seat at the table at the actual Emergency Response Center, which is in Doral as well. So we get to see things in real time. We sit there with other people, heads of government, et cetera, and we are basically, what is the community pulse, basically? And so we rotate there. But there are also shelters that pop up all throughout Miami-Dade County, and these are the ones that were here during Hurricane Dorian. Of course, we didn't have to use those because we missed the hurricane, but they basically could change at a moment's notice, and yeah, we'll have staff basically at each shelter. We get physicians to volunteer at those shelters, also medical students and pharmacists, et cetera. There are also social workers there. There are legal aides there as well. People may be saying, why would you need a legal aid? Well, in Miami-Dade County, people try to evict tenants from their houses during hurricanes, et cetera. And these are some of the problems that community members go through that people may not know, basically. So basically, in times of disaster, it makes everything worse, emergency mode. So, all the models that we do, et cetera, when you put those to the test, it really comes down to, is the community prepared to receive the infrastructure that is in place? And if not, then the same thing happens during Hurricane Irma. Basically, we got missed, and it was still, we had deaths and, people who became homeless and became climate refugees, et cetera. But also in Puerto Rico, you've seen, the breakdown in communication with water supply, et cetera. And in Houston and New Orleans was probably the worst thing that probably the United States has ever seen during a climate emergency, and we just don't want that to happen again. So this is what I tell physicians that they should tell their patients, about different vector-borne diseases, about allergies, et cetera. We also encourage people to refill their medications. A lot of pharmacies have programs where that you can refill your medication for free for up to a month or two with no hassle. You don't have to see a doctor to do that. And, just giving them little tips to make sure that they're prepared. We also give out, little emergency kits that people may need. Of course, we're there at the shelter, which is in walking distance. We try to tell them about those things as well. The Miami-Dade County has a lot of things that are in place as well, but the problem is that there's a breakdown in communication, and so a lot of people in the community don't know about these services. So when we go on these tours at churches and community places, we actually tell them about, the services that we provide around, if you have chronic disorders, they come and pick you up, 2 weeks before or a week before a hurricane, and they house you in the hospital, et cetera. And that these are resources that we expect people to use. And that they should know about as well to mitigate deaths, particularly during climate emergencies. And then the last thing we also talk about is to get political. The thing that we know is that the social determinants of health are directly related to political outcomes of things that elected officials do, et cetera. And so you want to make sure that, that in order to keep yourself prepared, and you want to make sure that you're up on everything that's going on politically in the city and in the local level and the state level and on the United States level as well. So with that said, sorry, I stood between you and lunch. How many minutes do I have?
We have time for a quick question.
Okay, cool.
Well, first, I want to say
Any questions?
I would just say thank you for amazing work in the
Oh, no
community.
problem.
It's great. Questions? Jennifer?
Is that on? So I'm amazed by what you shared. I mean, it just seems overwhelming, and we have plenty of stories of hospitals actually delivering patients in an ambulance to a shelter rather than taking people in advance and setting them up
Right.
for a preparation in a storm. You mentioned Broward shelters. I'm interested in knowing about the collaboration and whether you have a counterpart like you working up in Broward. We've struggled to get healthcare representation on some of the climate change task forces, for example. I think you're exactly the type of person that we would want to see engaged. So I'm interested in that. Really commend all of your work. I think really impressive. And I don't know how you find time for that in your day job, assuming you have one.
Two of me. Yeah, basically we do have representatives in Broward. Last hurricane season, it was through Nancy Maytayer, who basically ran the community shelter at the Old Dillard Museum, which serves at the Emergency Response Center in Broward. In terms of having physician representatives, there's a Florida Clinicians for Climate Action run by Dr. Holder. She's at FIU as well. And she was basically one of the lead people in getting people to volunteer at the shelter in Broward. But she's also a good resource around climate change and health and physicians' action around climate change as well. Any other questions? Okay, thank you so much for your time. Okay.